Accidental drowning rates in the U.S. have begun rising after decades of decline, according to a recent report by the U.S. Centers for Disease Control and Prevention (CDC). This concerning trend emerges as Americans prepare for Memorial Day weekend, a popular time for swimming and beach activities. The CDC's new vital signs report reveals that about 15% of U.S. adults, roughly 40 million people, do not know how to swim. More than half of all adults have never taken swimming lessons. This data coincides with an increase in drowning deaths post-COVID-19, with the annual average of about 4,000 drowning deaths increasing by 10% in recent years, adding 500 to 600 more deaths each year. Dr. Debra Houry, the CDC's chief medical officer, highlighted the human impact, noting that over 4,000 drowning deaths per year equate to over 12 deaths per day. The report also shows significant increases in drowning rates among preschool-age children, Black Americans, Hispanic Americans, and American Indian and Alaska Native populations. Drowning remains the leading cause of death for preschool-age children, with rates increasing by nearly 30% in 2021 and 2022. Black Americans experienced a 30% rise in drowning rates in 2021 compared to 2019, despite spending less recreational time in the water. 1 in 3 Black adults reported they couldn't swim, reflecting historical segregation and discrimination in access to swimming facilities. Hispanic Americans saw a 25% increase in drowning rates in 2022 compared to 2019, while American Indians and Alaska Natives continued to have the highest drowning rates of any racial or ethnic group. The pandemic likely exacerbated these trends by limiting access to swimming lessons and public pools. Houry emphasized the importance of swim lessons for safety and mentioned CDC-funded programs at the Red Cross and YMCA aimed at making lessons more accessible and affordable. A poignant example of the personal tragedy behind these statistics is Berkeley Champlin's story. Her 3-year-old son, Gordie, drowned in the family pool in 2020. Champlin has since dedicated herself to raising funds for swim lessons to prevent similar tragedies. She stresses the critical importance of swim lessons and safety measures like pool fencing, life jackets, and vigilance supervision. The CDC advises starting swim lessons for children between the ages 1 and 4 and encourages adults who can't swim to learn. Additional recommendations include learning CPR, assigning an adult to supervise children at pool parties, and securing pool access when not in use. As Memorial Day approaches and families head to water activities, the CDC underscores the need for swimming skills and safety awareness to prevent further drownings.